Okay, let's move on to the awards. Coming in at number 10 is North Carolina. This is their 5th year in a row in the top 10 thanks to key contributors like Community Care of North Carolina and Car Drug. North Carolina is also notable because physician adoption of e-prescribing jumped from 24 to 42%, and the state recorded a 3-fold increase in use of medication history. Joining us via Skype to accept the SafeRx Award is Dr. Troy Trigstad from Community Care of North Carolina.
Hi everyone, I'm humbled to receive this award on behalf of North Carolina. We've been at this effort for about 5 years now. First it started with Blue Cross and Blue Shield of North Carolina, who really was out in front on this in the earlier part of the decade. And re-energized that program in 2008, created a partnership between North Carolina Medicaid and Blue Cross and Blue Shield of North Carolina and Community Care of North Carolina, really to get out there and into the practices and to ask them, what is it that you need? What help do you need? And to start them on a technological pathway that we saw coming. Well, that's been a great effort with all of us over the course of the last couple of years, and then came along with High Tech and Affordable Care Act and a lot of the Medicare incentives, came the Regional Extension Center, and so it was a very logical transition for us to then move this to the Regional Extension Center. So we still have a community care model with Blue Cross and Blue Shield as a good partner, and then working with the Regional Extension Center to advance the e-prescribing adoption. And now e-prescribing is really part of a larger technology package that's going out to these practices and providers. And so it's been a really fun partnership to engage in. And again, it's very humbling to receive this award again on behalf of North Carolina. Thank you.
Our 9th place finisher has moved up 5 places to make our top 10 this year, Oregon. By increasing the participation of payers and boosting e-prescribing adoption to 47% of all prescribers, Oregon recorded the highest level of prescription benefit use in the nation at 64% of all patient visits. We're pleased to have Dr. Thomas Yackel of Oregon Health and Sciences University with us to accept the SafeRx Award.
I'm honored to accept the award on behalf of Oregon providers for implementing e-prescribing. We are proud to be a leading state when it comes to health information technology and see e-prescribing as an essential technology for healthcare. E-prescribing electronically connects providers and pharmacies and is an important aspect of health information exchange. It gives us the capability to improve efficiency in medication prescribing and puts more information in the hands of providers as they're making clinical decisions. Patients appreciate our ability to send their prescriptions anywhere in the country, and providers like the fact that they can send prescriptions wherever they are, even using mobile devices. For us, e-prescribing has been an important step forward in our journey toward meaningfully engaging patients in their healthcare with information technology.
Iowa just missed the top 10 last year when they came in at number 11. We're happy to announce that this year they made it in, moving all the way to number 8. Iowa has doubled their use of e-prescriptions from 16 to 32% and recorded a 6-fold increase in use of medication history. Joining us via Skype to accept the SafeRx Award is Dr. Douglas Van Dale from the University of Iowa Hospitals and Clinics.
Well, I am very happy on behalf of the state of Iowa to accept this award. This is really a great step for our entire state, for us to be able to improve our patient satisfaction, improve our patient safety, and improve our provider satisfaction with this electronic means of prescribing medications for patients. So interestingly enough, we have had the ability to do electronic prescribing for some time here in the state of Iowa, but our adoption rates haven't perhaps been what we expected they would be. And just within the past year or so, we made the electronic prescribing really the preferred option. Prescribers were initially a little bit concerned about the extra steps that it may take, or concerned about the safety or the validity of doing it. But clearly our patients are very, very happy. They expect electronic prescribing. They can't wait till they can get even more prescribing, such as narcotic prescriptions via e-prescribing, because all of our patients love it. It's their preferred way of getting medications.
Next, we're proud to announce another new entrant into our top 10 this year, Finishing in the number 7 spot is South Dakota. South Dakota registered a 5-fold increase in medication history use while doubling its use of prescription benefit information. Congratulations to South Dakota. Our next state is making its 3rd appearance in the top 10 this year and moved up 1 position from its finish last year. Coming in at number 6 is Pennsylvania. This year, Pennsylvania was particularly proud of the fact that they tripled their use of medication history while providing physicians with a patient's drug benefit information for over half of all patient visits. Accepting the SafeRx Award for Pennsylvania is Dr. Joseph Habig from the Medical Association of the Lehigh Valley.
Hi, I'd like to say thank you and accept this award on behalf of all the hardworking physicians that are out there seeing patients and using this great new technology. We started doing e-prescribing in June of 2007, and there's 40 or 42 of us, and I can, I think, speak for all of us in that we've all been challenged by this new technology. It's been a big change in our office practice. But the best part of it really has been the e-prescribing. It has been the single biggest thing that has really altered our practice in a positive way. Some doctors, not me of course, but some doctors are accused of having poor penmanship and writing, so that when you can reduce medical errors due to legibility issues or sound-alike drugs, that kind of thing, certainly it's a great benefit for the patients. I've seen a great deal of cost saving, both in the workflow of my staff, less time faxing and calling in prescriptions. Prescription refills come right into my task box in my EMR, and I can take care of them and send them right out. It's much more convenient for myself, for my staff, and the pharmacists, but I think patients love it the most. But you know, physicians, we find it just much more convenient, and it's actually freed up our staff to do more other things directly involved with patient care. So it's been a winning situation all around.
Coming in at number 5 is Rhode Island. This is their 6th straight finish in the top 5. They are the only state in the nation to have 100% of its pharmacies e-prescribing. In 2010, Rhode Island saw its physician adoption rate reach 54%, and its use of medication history increase 3-fold. Joining us via Skype to accept the SafeRx Award is Jenny Chiller-Gordon of the Rhode Island Quality Institute.
I am honored to accept the Surescripts SafeRx Award on behalf of Rhode Island. This marks the 6th consecutive year that Rhode Island has been one of the top states in the nation in electronic prescribing. This award is a testament to the collaboration of many organizations and individuals across our state, including providers and their staff, our patients, our pharmacies, and the members of our statewide electronic prescribing committee. We are particularly happy to say that the majority of our e-prescribers are doing so through their electronic health record. This success in adoption has led to marked improvements in the safety of our patients. It eliminates illegible handwriting, reduces the risk of medication errors, is convenient for our patients, and also reduces the overall costs of healthcare. On behalf of all of us in Rhode Island, we want to congratulate all of this year's award winners, and we look forward to continued success in 2012.
This year marks Connecticut's 4th appearance in the top 10 as they move up 2 spots from number 6 to receive the SafeRx Award for our number 4 spot. Connecticut attributes its success to the fact that it is the state with the highest usage of medication history. Additionally, this year they doubled their number of e-prescribers. Congratulations to the Nutmeg State. At the number 3 spot is Michigan. They remain a powerful force in e-prescribing. This is their 5th time in the top 10. The state was propelled by the highest rate of participation among health plans providing drug benefit coverage for patients in the state. Michigan is the only state in the nation to finish in the top 10 in all 3 subcategories of e-prescribing use. This reflects the successful planning and coordination of several organizations across the state, including the Southeast Michigan e-prescribing initiative, Health Alliance Plan, and Blue Cross Blue Shield of Michigan. Accepting the award via Skype is Matt Walsh, the Chief Operating Officer of the Henry Ford Physician Network.
Hi, I want to say I'm honored to accept this award on behalf of the state of Michigan. I also wanted to mention that the growth and adoption of e-prescribing here in the state of Michigan is really a testament to some unique partnerships we've developed in the space of e-prescribing. One of the most key success factors has been the Southeast Michigan e-prescribing initiative, which is a collaborative between both business and healthcare and health insurance in helping to promote e-prescribing throughout the region. Usual competitors have become partners in spreading e-prescribing. So Ford Motor Company, Chrysler, and GM partnered with Henry Ford Health System, which includes the medical group, Henry Ford Medical Group, and Health Alliance Plan, and Blue Cross and Blue Shield of Michigan to put together a program that really enabled doctors in the region to get onto e-prescribing fairly easily and make the transition. That's really made it spread like wildfire within the state. The key benefits that we've identified through e-prescribing have been the reduction in medication errors, and because we're using it so much, we've actually been able to really measure and demonstrate value in that space, as well as increases in productivity among the physicians that use it, and the patient satisfaction has been tremendous with the use of e-prescribing.